Hi guys, sorry for the delay. We had some technical issues with the computer, so I'm doing it on my phone, so I really hope this still works. Apologies for the early morning. Time's limited at the minute, obviously with lockdown and childcare issues. So if you don't get to join now, hopefully you will join and catch up later on today. So thank you for all of your questions. To be honest, we had so many repetitive questions, with a slight variation. So I'm going to kind of join them all into a main topic today. And hopefully it will answer everyone. So the main thing that came up within the questions is about tick increase during the lockdown and also a tick decrease during the lockdown. And people really confused and baffled about how this is happening. So the main thing we want to talk about today is the environmental factors and what huge influence they have on ticks. So basically, anything that happens before and after a tick can hugely affect how our ticks come around again. This is because of our basal ganglia. Now, what happens is our basal ganglia is in control of all of our movements that come out into our body. It's essentially like a filter system for us. Now, this isn't just for people with Tourette's, this is how everybody's basal ganglia work. So we have an instruction from up here, the top part of the brain, it comes down to our basal ganglia. Our basal ganglia puts the brakes on to stop movements coming out unnecessarily. But also lets things out that are appropriate. Now, what happens with people with Tourette's, they have, it's assumed and thought that they have a 10% smaller basal ganglia. There's also a theory of the slightly overactive dopamine levels. Now, because of these two concepts, sometimes our basal ganglia don't put the brakes on quick enough. Now, this results in these movements coming through, and this is what is assumed to be a tic and why tics happen. Now, what our basal ganglia do is they let these movements through, whether they're supposed to come through or not, and then they look into the environment to see what kind of feedback they get, and they do a feedback loop. Now, if something positive happens from their movement, or say we're saying a joke, this isn't tick related, and they get a laugh, chances are they're going to say that again. If they didn't get a laugh, they're not going to say it again. Now, this works the same with tics. If you do a tick and you got some attention, or you got out of something, this will tell the brain, something good happened here, so I'm going to do it again. Now, this is where I really want to focus on the fact that just because these things can reinforce the situation, that doesn't mean they're being done on purpose. This is all because of how our basal ganglia work. So if you see that a child is doing something and you think that maybe they're doing this for attention, they're not. It's absolutely not the case for attention or for demand avoidance. It's simply because our basal ganglia have searched, they've got positive feedback, so the brain tells us to do it again. So some of the things that happen beforehand, so we're looking at antecedents here, could be stress and anxiety, fatigue, transitioning, so moving from one homeschool lesson to another, or going for your 1 hour walk at the minute. Boredom is a big key at the minute, or going out in public. All these different things, these are antecedents, these are all things that happen before tics. That can either exacerbate or reduce them. Now, this can be different for everyone. What triggers someone's tics could decrease someone else's tics. It's very personal to each individual. There's different strategies we can use for these antecedents. So an example here would be stress and anxiety. We would try and reduce the stresses, and we teach relaxation. Fatigue, obviously we really try and get them to get enough sleep. Obviously, I know this is difficult, especially if you have a comorbid of ADHD. Sleep is, is a real problem, but if we can support their sleep, this will be beneficial for them. And also, if they have a busy school day, obviously home learning, schedule in breaks and mix it up, get some fun activities in there alongside the learning. Regarding transitions, use visual planners. Put a visual timetable up, let them know exactly what's happening next, what they are expected to do at the end of the day. This also really moves on to the boredom aspect. So again, put up those planners and have schedules in place for the different activities you're going to do to try and prevent times and sessions where they've got nothing to do. Going out in public is a really, really good way to just teach them how to react if someone asks them about their tics or comments. One of the best things to do is actually empower our children. So with regards to the consequences side of tics, sibling attention, parent attention, this happens to a lot of people. So it's a natural thing for a parent to do. Your child starts ticking, you hug them, you give them comfort. Now, I know this is so weird, having a son, with Tourette's myself. We just want to comfort them, we want to hug them, but actually the best thing to do is ignore the tics. Or if you do need to comment or see if they're okay, which obviously if they're hurting themselves you're going to do. But instead of focusing too much attention on tics, just maybe start prompting some coping strategies. So if they've done any behavioural therapy, you can use those techniques or some relaxation methods. So just try and redirect them into supporting them to cope. So I'm going to do a lot more information on the environmental factors element of tics, but I just really wanted to touch on that for everyone. Now, you can access a form, which I'm going to put up on the page later today, where you can fill it in and try and actually work out what might be triggering your child's tic increase. But it's also really good to do to see what's decreasing them, because when you work out what's decreasing their tics, you can actually spend more time doing that. So if you're like, oh, this works really well for my child, you can start scheduling that in several times throughout the day, for example. So the main thing to do, like I say, I have already just mentioned, is ignore. Wherever possible, ignore your child's tics and pretend it never happened. And it is difficult. My son has a tic where he shakes his head, and if he's sat next to me, the natural thing to do is turn if you see movement, because I feel like he's about to talk to me or something. So it's really hard as a parent, to try and not pay any attention unless they call your name. But the more you practice it, it is easier to do. Now, moving on from that question, someone asked me this, which is a great question because I've seen this flying around quite a lot on some of the Facebook forums. Now, that is how their child's tics have gone or really decreased since they've been out of school, and should you consider homeschooling? This is a personal choice. You need to do what is right for you and your family. However, do bear in mind that, sometimes when we're trying to protect our child now, it can hinder them when they're older. Our children are going to be adults. They're going to have jobs when they're older. So actually, instead of maybe taking them out and making things too easy for them, why not teach them resilience? Let's empower them. Let's encourage them. Things are going to be hard. We know that. We can't, take that away. We can completely accept that. But we can teach them skills on how to move forward and get on with their life as best as possible with these tics still there. Now, the last thing I'm going to touch on, which actually came through quite a few times with questions, was how long a tic's going to last, especially if Tourette's has been ruled out. So we've got different tic disorders, and the main three are chronic, persistent, and obviously Tourette's syndrome. Now, with the chronic tic disorder, this is reoccurring vocal or motor tics, and these occur for less than a year. So the answer is within the title there, these are less than a year. If, however, you have a persistent tic disorder, which is reoccurring vocal or motor tics, but this is not both, remember, they last longer than a year, or you have Tourette's syndrome, this is where you have vocal and motor tics, so both of them, again, this lasts longer than a year. There isn't a definitive answer on how long this is going to be. This is very personal and very individual. The clinical course of tic disorders is typically that they emerge in early childhood, 4 to 6 years old. They usually peak in early adolescence, but they often reduce by early adulthood. Again, this is really individual to everyone, do bear in mind, you know, if your child's tics go, just be mindful. They might come back because it's a natural course that tics take, where they wax and wane. As long as you know that they could come, they could go, you could have, you know, even a few years where they go completely, and they could come back in adulthood. Just always be mindful that they are there. But that's okay, because hopefully by early adulthood they will reduce enough that you can, you know, live your life fully with no complications. Now, I'm really sorry that was such a brief whiz through. I have got an appointment in the next 5 minutes, so I need to get going, but I really hope that was helpful. If you have any more questions, please get in touch, and I will hopefully do this again soon. Thank you for watching.